Okay. Welcome, everyone. Welcome. Good morning. Sorry, good evening. Yeah. Good evening. Welcome to the very first training for tonight. This is our 2025 edition, February batch. So, welcome, 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 welcome. And yes, we have started. So, I would love, okay. Welcome, welcome. Please, if you're here, can you give me a comment in the comment section? Just five, give me five. Just write five in the comment section. Five as a number. I want to be sure that everybody can hear me. If you can hear me, if you are following, just write five in the comment section. That will show that you are here and you are following. Just type five in the comment section. Five only. Five. Okay, I'm waiting. Beautiful. Welcome, Mrs. Hannah. Welcome, Mrs. Zainab. Beautiful. Let's type five in the comment section. That would show that we are here. We can hear me. Welcome, Mrs. Adepoju. I don't know if I'm getting that correctly. I am not Yoruba. Welcome, Mrs. Kelani Abiodun. Nice to have you. I have a friend. His name is Abiodun too. Welcome, everyone. Okay, so quickly, I want let's do something for me, okay? Mrs. Adefeisan Hannah. Thank you so much, Mrs. Modupe. Welcome. So quickly, I want you guys to do something for me. Can you go to the group, our training group, and type "We are live"? We are live. In the next 2 minutes, we are going to be kickstarting. Welcome, Mrs. Moriamo. Can you someone help me go and type in our training group? We are live. We are about to start. We are live. Join in, tune in, join in. We are starting. We just have 13 persons and we need to get to like 50 before we start. We are 18 now. Beautiful. We need to get to like 50 before we start. So can someone go to the group and say we are live, we are starting, we are live. Tune in. Beautiful. Thank you so much. I'm seeing this is nice. I'm seeing this. Oh, thank you, Mrs. Bear. Oh, beautiful, Mrs. Seyi. I love that. I love the responses. The responses is giving ginger, is giving motivation. Thank you, everyone. Thank you so much for the responses. Thank you. Okay, so exactly 8:04, and we are going to be starting. Exactly 8:04. Welcome, Mrs. Joy Chukwuche Kwaya Igbo. Nice to meet you. I'm Ibo as well. Nice to meet you. Welcome, Mrs. Lamidi. Thank you so much for joining. We are still at 15. We're supposed to get to 50 before we start. We're supposed to get to like 50. We're 18 now. Let's keep going. We are live. Go to the training group. Type we are live. We are live. 22. Beautiful. We are getting there. Welcome, Mrs. Evelyn. Welcome, Mrs. Evelyn Joshua. Welcome. Welcome. Yes, thank you so much, Mrs. Oluwatoyin. Did I pronounce that right? I think I did. Welcome so much. I am so happy to have us all here. It's a delight to have everyone here. We are 26 now. We are starting right about now. Okay, so I'm going to be sharing my screen with us. It's shared already. Yeah. We can see my screen, right? Okay. Quickly, we're going to be starting. This training is not going to pass an hour 30 minutes. This is an hour training. Yes, the training is just for 1 hour. So we are going to be very fast with what we have to go through tonight. So moving right into it. Yes, I hope you can see my screen. Our tag is how 2025. And I'm very much sure that we're not just parents here. Some of us are here, are caregivers. Some persons here are carers. They are therapists. But in as much as you are here, I'm sure you have a responsibility to care for a child. So I'm going to give a slight and a very brief introduction about myself. Okay. So my name is Fortune Emmanuel. I am the team leader at Unique Child Care Services. I manage mainly careers, the carers, the caregivers under Unique Child Care Support Network. Okay, we deal mainly with caregivers, working moms, stay-at-home moms. We also provide quality education and support networks. For me, I'm very passionate about teaching people, especially working moms and stay-at-home moms, on how they can provide solid care to their unique children. In unique child care, we call the kids unique children and the parents unique moms. Okay, moving on. So, by the end of this training tonight, by the end of this webinar, you're going to learn first reasons why it is difficult to care for unique children. In as much as we'll say, oh, they are special kids, they are unique kids, it is difficult. I'm going to say it as much as I can. I'm not going to mince words because we're like family here. So I'm not going to mince words. I'm not going to sugarcoat anything. I'm going to tell us how it is. It is quite difficult to care for unique children. So I'm going to be telling you reasons why it is difficult. The second thing is I'm going to talk about understanding the right mindset because it's very important that we have the right mindset towards these children. We develop the right mindset towards these children, towards ourselves as parents as well. God is self-care for unique mothers and carers. Yes, many people don't really talk about this, but I will because it's very important that as a parent of a special needs child, in as much as you are amazing, you are a super mom, you need to take care of yourself. You need to take good care of your mental health, your emotional health, your physical health. So we're going to talk about self-care for unique moms as well. Then we'll talk about types of special needs condition. I'm going to be talking about the very common ones in Nigeria, in Africa as a whole. Yes, in Africa. The very common ones, we have ADHD, we have ASD, Down syndrome, sensory processing disorders, and cerebral palsy. These are the very common special need conditions in Africa. And next, I'll be talking about misconception about unique children. Okay, and also ways to make caregiving more interesting, ways that you can make caregiving, take care of your child, very much interesting. Okay, now these are reasons why you should listen to me. People will be asking, so why am I supposed to listen to you? So why should I spend 1 hour of my time listening to you? These are the reasons why you should listen to me. I have over 4 years of experience in caring for unique children at both Utmost Care and Therapy Services in Port Harcourt and PPTC in Port Harcourt to River State. So in the space of 4 years, I've worked with these organizations and I've cared for over 15 unique children directly, like direct therapy sessions. I have also acquired certification in relationship and emotional management, which has enabled me help parents care effectively for their unique children. Excuse me, please. Okay. Okay. Can we still hear me? I hope you can still hear me. All right. All right. Next, we have reasons. We're moving straight into the training. So I'm going to tell you reasons why it is difficult to care for special needs children, to care for unique kids. First is lack of adequate training and knowledge. If you're not properly trained, if you don't have the right access to resources, the right access to knowledge on how you can provide adequate care for these children, it will be very difficult for you. I'm going to be very honest. I'm going to hold your hands when I say this. It is going to be very difficult for you. If you don't know what you are doing, you don't know what the children are even actually suffering from, you've not done the right assessment for these kids, it will be very difficult for you to provide adequate care for these children. The next is psychological and emotional difficulty. Very, very important. We have lack of finance to pay for professional therapy. This is why it's difficult to care for unique children. People say, in fact, it's not people say, I have worked in therapy organizations. I know how difficult some parents find it to actually pay for their children's therapy services in the organization. If they don't have money, it's very difficult to pay. You cannot pay for professional services when you don't have enough adequate finance. Picture. Okay. Next, we have is lack of patience and commitment to improving your unique child sustainably. You have to be patient. As a of it, you have to be patient. So many times the children will test you. If you have, let's say you have a child who has autism spectrum disorder, and the child is very hypersensitive. I saw in our training group, a woman said, a unique mom, she said, oh, she wants to learn how to stop her child from walking up and down, staying at a place. If you are not patient, if you are not even committed to improving the unique child of that uniqueness of your child, it's going to be very difficult for you to care for your child. Okay, you have to master patience. So patience is a virtue, it's a big virtue, and you as a unique mom, you have to master patience. So many times I talk to people, women in my support network, I tell them that patience is something that we have to cultivate. If you're a mom who, oh, you are easily agitated, you cannot, you find it very difficult to work with your child. You find it very difficult to care for your child. So you have to master the art of patience. Okay. Next, you have to be very committed. Like, I want to succeed at this. I want my child to start getting potty trained, to use the potty when he or she is supposed to use the potty. I need to master the art of commitment. Let me be committed to doing this thing. I need to put in the work. You have to be very committed to improving your unique child sustainably every day. Don't do something today and tomorrow you are tired. Oh, you not see progress today. Why do I have to continue tomorrow? Oh, today I did this. Oh, why am I supposed to count? I counted with him and he forgot it. Why? I cannot do it again. No, I am tired. No. If you are going to be a unique mother, you have to master the art of patience and commitment. It is very important. Okay, I'm going to be very fast. So now I'm moving right next to understanding the right mindset. Can we still hear me? Can we still hear me? Okay. Someone is saying network is slow. Mrs. Precious, I'm very sorry. And oh, Mrs. Clara, you too? Okay, yes. Thank you, Mrs. Wumi. She said she can hear me. Thank you very much. So next we have understanding the right mindset. Okay. First thing we have to take note of is resilience. This is a beautiful word people use in sentences, but they don't act according to the word. Resilience is important. You as a mother, you have to be resilient. Okay, you have to embrace challenges and setbacks as opportunities for growth. You have to embrace whenever you have challenge, and you will have challenges. Oh, very. I don't used to mince words. I'm always not sugarcoating. I will tell you how it is. You you will have challenges. Some days where you have setbacks. You did this today and the child followed suit. Tomorrow you are trying it again. The child is acting like, oh, I have not had this word before. I have not done this before. I have not used the potty before. Why are you asking me to sit on the potty? You have these things will happen. It's a normal thing. It happens if you are going there anymore. But what you have to take note of is that you have to be resilient. You have to embrace these challenges as opportunities for you to grow and become better. You have to embrace these setbacks as opportunities for growth. You have to maintain a strong and determined spirit. You have to be determined. This is what I want to achieve. This is what I want to get at, and I must get at it. Embrace all of these challenges because you have them. They are opportunities for you to grow and become better. So what happens is that when you have setbacks, you have to think of better ways on how you can elevate. Oh, you tried to use the potty. Okay, let me use another let's say you try to sound letters to your son, A to Z, and he could not sound it the first day. Second day he could not sound it. The third day he finally was able to sound A to F. That's A to F. The fourth day you are trying to let him sound it, but he does not even remember ah anymore. He does not even know how to sound ah again, and you are frustrated. You are like, what am I going to do? You are now getting frustrated. Use that opportunity to grow and become better. What you have to do is that, oh, what is my pattern of teaching him how to sound? How can I change my pattern? What do I do better? How do I do this better? How can I sound these letters to him better? So embrace those challenges, embrace those setbacks as opportunities to grow. You have to maintain a strong and determined spirit. Next is empathy. Yes, you have to foster deep empathy to truly understand and respond to your unique child's needs and emotions. See, you are a unique mom. especially mom, you have to you have to cultivate this spirit of empathy. That's the only way you can truly understand your child. That's the only way you can truly understand and respond to your child's needs. Some parents don't even understand their children. If you don't cultivate the habit of having empathy, you cannot truly understand. You cannot truly respond to your child's needs. You cannot truly respond to your child's emotions. Okay? The third thing is flexibility, which is very important and which some parents find it very difficult with. You have to be very flexible. You have to be very, 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 very flexible. Okay? What this means is that you have to adapt to changing circumstances and be willing to try new approaches. Oh, you keep on trying this pattern, you keep on trying this, and it's not working. You have to change, move. You have to adapt. Let the circumstances make you change. Try new approaches, try new patterns, try new solutions. Oh, you have that's why you have a support network, which is very important. Very people parents have gained a lot from unique childcare support network. You come and you say, ah, mama, see what I'm trying, oh, but it's not working. Your some parents will not even come and tell you, but I tried this and it did not work. And look at what I tried and look at how it's working for me. You have to be very flexible. Okay. Fourth is positive attitude. Very important. This is one of the most important mindset you have to have. You have to be a very positive attitude. Oh. Okay. Don't be one of these parents that would say, me, I've actually worked with parents who they would be like, ah, I beg you, if it does not work, leave it. It does not used to work. Why are you stressing yourself? Leave him. He cannot do this. He's always win on himself. I have tried everything I can. I have tried to potty train him. I still cannot potty train him. Leave him. It's not going to work. It's not going to work. Just leave him. Parents have come and have said all those things. They have even said, Omo, anyhow way he be, make he be. Oh. Me, I no even cook math, no be me kill Jesus. I no be me do this one. So anything we won't happen, make it just happen. There's no positive attitude. There's no positive outlook. It is very bad. It is very some people even diverge and they move to that level to their children. So now they not even the negativity now spreads to their child, which is very bad. These special children, they are very smart. One thing you have to understand, they are smart. They read the room so quickly, so fast, so fast. Okay, so if you are a parent who you are very negative and it shows in your words, it shows in your actions, it shows in your body language, you are negative. If someone is saying, oh, your child could not clap yesterday, today your child is already clapping. Ask your child to clap and it's already and you're like, clap, okay. Ain't go so forget them. Oh. It's bad, oh. That is not something you are supposed to cultivate. You have to cultivate a positive attitude. Okay? And you have to focus on the child's strengths. Yes. Don't always look at the weakness. You know that your child has progressed. Focus on that strength. You know what your child could not do yesterday and he was able to do it today. Applaud your child. Positively reinforce, no matter how small. I'm always telling my parents in support network, always clap, always applaud your child, embrace your child. Your child was not able to do this. Oh, he's even trying. He's taking 3 steps at a time. Applaud your child. Embrace. Positively reinforce your child every single time. Celebrate victories, no matter how small it is. Even if your child just learns how to give a high five, make sure you celebrate that child. It will reinforce them to do better. Next, we have is self care. Prioritize self care to sustain energy and mental health. You have to recognize that a well cared for caregiver is better equipped to care for the child. Yes, we are still going to talk about self care in the course of our training. Next, we have is continuous learning. Give me a minute, please. Okay, thank you so much. Next, we have is continuous learning. You have to commit to ongoing education about the child's condition. So many parents just one training that you did, and that is all. You don't even bother to do more, you don't even bother to check, you don't even bother to browse, you don't even bother to reach out anymore. You have to commit to going on and on and on about how you can get your child to be the way you want your child to be. Okay, commit to ongoing. I'm so happy that we have so many moms here. I'm so happy that we have so many moms here. happy that there are so many moms that want to learn and be better. Okay, don't worry, Mrs. Ola Leyi. Don't worry, we are going to have time for questions. We're going to have time for questions, and we'll read everybody's questions. I'll take our time to respond to as many questions as I can. Okay, so for now, let's just listen to what I have to say. Next, we have is continuous learning. Here, commit to ongoing education. Okay, commit to going about how you can move on, how you want your child to be. So learn, research, do things that you are supposed to do to improve your child's way. Okay, new excuse me, therapies, new therapies, effective strategies to provide the best care. Just do things that you ought to do so that your child would improve. Very important. Now we are moving straight to self-care for unique moms and carers. Now I know I've said this before, and I've said it again. As much as you are a super mom, you are. Oh, we love you so much. We appreciate you for being a superhero, super mom. You need to take care of yourself. It's very important. It's very important that you cultivate this habit of taking good care of yourself as well. Don't leave yourself. It's not the end of the world. Nothing is going to happen. You are not going to die. Don't be suicidal. Don't think like that. Prioritize self-care. Prioritize self-care. Have a consistent routine. Now, consistent routine have in time past helped a lot. It has helped, and it will always keep helping. To never stop helping parents. You have to develop a consistent routine. Now, what this means is that you have a routine, follow through it. Let your child even know what you have to do. Okay? Give your child that privilege of even knowing what comes next. Have a consistent routine, even for yourself too. Have daily schedules for meals. Have schedules for therapy. Have schedules for bedtime. Okay, now we are going to sleep. It's bedtime. You now sing one small song. It's bedtime. Bedtime. I tell parents in my support network, be creative. Oh, be very creative. You have to learn. In fact, you have to form things yourself. Start thinking of how you can get new rhymes. We have created rhymes. So many parents in our support network have created rhymes. Like they now sing rhymes that they have created themselves. Just make things exciting. Don't be frustrated all the time. Okay? Make therapy beautiful. There's time. Oh, it's bedtime. Start singing. It's bedtime, bedtime, bedtime. Sleeping time. Oh, sleeping time. Like just make things look exciting. Okay. Now you have a consistent routine for bedtime. The child knows after dinner. Next is sleeping time. Oh, what am I going to do? I'm going to put on my pajamas. Okay. Let's say you are showered already. So next is we're going to read a book. We're going to read a book on. We're going to talk about the ants and the lion. Something like that. After reading the book, next is we say a prayer, and next we are sleeping. Have a routine for every single thing. That is what helps in therapy. It helps a lot. Next we have is support. I want to be very fast. I don't think I have much time. Next we have a support network. Yes, this support network is very important because you as a parent, you need it. It's important that you prioritize self-care. Okay, so you have to have a support network. You have to connect with family, connect with friends, connect with people that believe in you, connect with people that would lift your spirit. Don't connect with people that will drain you down. Don't even engage conversation with people that will drain you down. Some people have come to me and have said someone even asked me to kill my child. It doesn't work that way. A parent has said someone asked me to even throw my child away. No, you don't have to connect with such people. See, you have to take out any negativity. If this is not influencing me positively, influencing my family and my child positively, I don't want to have anything to do with you. So people that will come and tell you, this your pikin, they progress, they ever talk, go talk forever. Waiting they happen. Don't have communication with those people. Derail yourself from, like, detangle yourself, detach your any word. I don't know the proper word to use. I don't know how to explain how those people get to us. Things that they say will eventually get to you. It will get to you. You will know, you will act, you go and you cry. That's why you have to detangle yourself from them. Move out of. No, don't ever say that. My child will speak. Please caution them. You should never use such words. Okay, you too as a mother, you have to be positive as well. So engage, connect with family, connect with friends, connect with support groups, which is very important. Support networks that would, you see, calibers of unique moms like you too, coming to talk about their challenges, their strength, their progress, what they did, and how what they did actually helped them. Okay, connect with people like that is how you grow. Next, therapeutic activities. As a mom, you have to have, if I you should have hobbies, have things that excite you. If it's music therapy, beautiful. Exercises. We have, in the course of our support network, we've even had occasions where we talk about breathing exercises. We've taught moms how to breathe. You should learn how to even take a breath yourself. Breathe in, breathe out. There are so many exercises that you can do. Yoga, Pilates, anyone that works. But this is what you should do for yourself as a mom. Next is personal time. You have to prioritize personal time. So go on regular breaks. Go on self-care activities. Do things that make you happy. It's not the, I keep on saying it is not the end of the world. No, it can never be. It can never be the end of the world. No, it can never be. Okay, so go on regular breaks, breathe, take time to think. Some parents, because they have children that are unique, them themselves, they have lost themselves. They don't even do things that make them happy anymore. They don't make their hair anymore. They don't look good anymore. They wear anything they want to wear because they are frustrated. It shouldn't be like that. Go out. It shouldn't be like that. Next we have is education and advocacy. And I've said this before. Stay informed, okay? Stay informed, stay informed, stay informed. Yes, you have to advocate for your child's needs. Do things. Oh, you need this. Oh, what can I do better? Ask questions. Very important. Oh God, I love women that ask questions. I love unique moms that come and say, "What should I do better? How can I do this? Oh, I want to portray my child. This and did you know that portraying is very easy? It's actually very easy. This is like one of the easiest tasks we have dealt with in our support network. And parents have come and say it has worked. Ma, I did not even know that it is very easy to portray a child. I did not even know that can use the pot is so easy. It is very easy. Okay, but how does it become easy to you? If you stay informed, if you learn, if you reach out, that is how you can do things that you want to do effortlessly. Next we have is, now we are moving straight into the types of special needs condition. Okay, excuse me. Okay, have less than 40 minutes. Types of special needs conditions. The first one, we're going to be, like I said earlier, we're going to be mentioning the very common ones in Africa. These are the ones that are very common with children in Africa. First, we have is ADHD, and I don't think I've not had a parent complain about the child having ADHD. I don't know. It's a very common neurological disorder. So ADHD, which means attention deficit hyperactivity disorder. Now, this is a neurodevelopmental disorder that is characterized by inattention, characterized by hyperactivity and impulsivity. So individuals with ADHD, they may struggle with staying focused, following instructions, organizing tasks, and controlling their impulses and activity levels. Now, what this means is that the child has, okay, let me just start from the first. Attention deficit hyperactivity disorder. Now, the child has an attention deficit. So, what it means that the child has low attention span, the child cannot concentrate on one thing for so long. Let's say you are showing the child book filled with domestic animals, and this is a dog. You're trying to make a sound that a dog makes, and oh, the dog makes woof woof kind of sound, and you're pointing to the child is following suit, the child is looking at you, and in few seconds, the child's attention moves. Actually, children with AS, they also have symptoms of ADHD too. Their attention is their span is very short, very low. It doesn't waste time, and they are forgot, they are not even there anymore. So that is one symptom of ADHD. Next is hyperactivity disorder. Now, some of these children, they are very hyperactive. Okay, they have either, now hyperactivity is in two forms. We have hypo hypoactivity and hyperactivity. So hypo means the activity level is very low. Now hyper is very high. I don't know if you understand what I mean. Hyper means high, hypo means low. So for ADHD children, they have hyperactive disorder. That means it is very high. They are very hyperactive. One time they are screaming, they are jumping, they want to move here, they want to move there, they don't want to stay. They are scattering the whole house. They are moving and they are, oh, I'm scattering my house now. Okay, they are moving from here to here. They are scattering this place. They don't want to stay at a place. That is what hyperactivity disorder means. Okay, impulsivity. This one, they will do things out of impulse. They just stay and they just like that. Okay, now children that have this hyperactivity disorder, they may struggle with staying focused. They cannot stay focused for so long. They struggle with this ability of staying focused. They struggle with following instructions. David, bring your bag and drop it here. David does not even want to do what I'm asking him to do. David is already jumping. David is already screaming. That is one symptom of ADHD. Organizing tasks. David, keep your book on the table. Keep your book on the table. David does not want to keep his book on the table. David is carrying the book. David is even flinging the book. That is one symptom of ADHD. Controlling their impulses and activity levels. Very, very, very important symptoms of ADHD. Next, we have the sensory processing disorders, which is also a very common disorder in therapy. Now, SPD, which is the common short of sensory processing disorder is SPD, is a condition where the brain struggles to receive and respond to sensory information. Okay, so now there's something called sensory integration process. Now, what this means is that it's actually an activity where sensory active different types. We have the rhythmic movement, we have the ball and socket. There are so many activities in this sensory integration therapy. So many. Don't worry, in the course of our training, you would not this training, another training, you'll learn more about SPD and what sensory processing disorder means and what sensory integration therapy means. So some of the children they need massages. Sensory integration includes massages, therapy sessions, which includes you holding the child like something like physiotherapy. Yes. So for a child who has SPD, those things does not even work for the child. Okay, you are trying to do things for the child. You're trying to hold the child's leg and do maybe let's say rhythmic movement for the child. The child is not even processing what is happening. The child does not even know what is going on. The child is struggling to receive and respond to that information. That is what SPD means. Characteristics include oversensitivity. Now, oversensitivity means, let's say it's rhythmic movement. Which other activity? We have the rhythmic movement. There are so many activities. We have the rolling activity there too. So let's say you're trying to do rhythmic movement and you're holding this child, you're doing what you're supposed to do. But the child is oversensitive. Even holding the child is already shouting, the child is already laughing, the child is already screaming. The child is very sensitive to that little touch. So many children have this characteristic. They're very, very sensitive. Any small thing, they're already all over the place. Okay, that is one characteristic and symptom of SPD. Another one is under sensitivity. Now you're trying to do a massage for this child. The child does not. The child is just lying down there, just like that. You are holding, you are doing bonds, you are touching his joint, you are doing what you can do, and the child is not even getting, is not processing what is happening. That is what under sensitivity means. Next is coordination problems. Now, if a child is hyperactive, now sensory processing integration therapy is very important for that child. Okay, do things that will make child to be coordinated. If a child is very hyperactive all over the place, sensory integration therapy is what the child needs. It's what the child needs. Okay. Next is difficulty with everyday tasks due to sensory overload or confusion. Very important characteristics. We have cerebral palsy, which is the third one. Okay. Don't worry, we're going to get to everybody. We're going to look at everybody's comments and know how I can respond to everybody as soon as possible. Yes. So next we have is cerebral palsy, which is a very common special needs condition. Now I have noticed in our therapy group, in our training group, where I think we have a lot of moms who have kids with cerebral palsy. Yes. Even in our support network, I think we have few moms with kids who have cerebral palsy. Now, is actually getting more common. It's getting cerebral palsy is getting more common in Nigeria as a whole. Now, it's a group of disorders affecting movements. This is very important. Cerebral palsy, if your child moves, if your child can stand and walks freely without any disorder, without any discomfort, your child does not have cerebral palsy. And I will tell you mothers that please before you say what your child has. Okay, you have to go through the proper steps of diagnosis before you can say, oh, my child has cerebral palsy. If your child stands, walks, moves, hold things without it falling easily, can walk around freely, your child does not have cerebral palsy. So let's move on. It's a group of affecting movement, muscle tone, and posture. You see the children, they cannot sit, they cannot stand, they cannot bend, they cannot hold anything, they cannot even keep their neck straight. That is a symptom of cerebral palsy. Okay, the symptoms include stiff or floppy limbs. They cannot, excuse me, sorry, please, I need to take water. Okay, symptoms include stiff or floppy limbs. Their hands cannot even move. There's some of them, their hands are a little bit like this. They cannot move their hands. Or they can move it. Some people, their own is just very, very movable. That is another symptom. Involuntary movement, like they just be shaking or something like that. That is what another symptom of cerebral palsy. Poor coordination and difficulties with balance and motor skills. They cannot even hold a peg. They cannot do any fine motor activity. That is another symptom of cerebral palsy. Next, we have this one is the most popular, ASD, the most popular. When I joined therapy, the first challenge, the first child I worked with, he had autism spectrum disorder. It's a very popular developmental disorder. Now, this particular disorder is characterized by difficulties in social. I'll say children with ASD I've actually worked with, they are very intelligent. Yes, they're very smart. They're very, very smart. Oh my God. I worked with a three plus years old ASD girl who was so smart. She could practically do things. She could fix puzzles on her own without any help. And this puzzle, she has never seen it before in her life. I will just give her a sample and she's already following suit, feeling everything the way it's supposed to be. She can do this, she can hold her pencil, she can write when she's being assisted, she can do things on her own. ASD people, they are very smart, they are very intelligent, but look at their characteristics. They have difficulties in social interaction. Okay, they have difficulties interacting, they have difficulties even playing. Some of them, they have, not all, many of them, majority, they have difficulties in social interaction. They don't even communicate, they don't even want to talk to their peers, they don't want to play with their peers, they would like solitude, they want to be on their own, they don't want to be with everybody, they like solitary activity. Any activity that would just be them and the activity, that is what they want to do. They don't even want to join and play with everybody, they just want to stay on their own. Many of them have this symptom. Next is communication. Yes, many children with ASD, they have communication problems. Yes, they cannot communicate, they cannot speak freely, they cannot respond to questions when being asked, they cannot say things that they are supposed to say. Something is happening to them, oh, their body is itching them, they cannot even say that to you. That is one symptom of ASD. Next is repetitive behaviors. You see them doing things repetitively all the time. They have this behavior that they keep on exhibiting all the time. This thing is one symptom of ASD. Common traits include sensory sensitivities, fixed interest. Okay. Okay. Next, common traits include sensory sensitivities, fixed interest. Sensory, they are very, very sensitive. Like I mentioned earlier, they are very oversensitive or not sensitive at all. Okay, so that is one symptom too of ASD. Another one is fixed interest. They always have fixed interest on a particular thing. You see them, let's just say a piece of paper, something that is not even very serious, and you see them looking at that thing very, very solely looking at that thing, playing with that thing that doesn't even look like a toy. You see them having a fixed interest on that thing. That is another symptom of ASD. Now, if you can hear me, if you're following, just type one in the comment section. Just type one in the comment section. One. One. That is how I'll know if you're following me. If you follow me, just type one in the comment section. Okay? I'm waiting for us. One in the comment section. Thank you so much, Mrs. Kelani. Thank you, Mrs. Bad. I am following. I am so happy to see you guys. Thank you, Mrs. Kafilat. Thank you, Mrs. Monisola, Mrs. Jola, Fajimi. I don't know if I'm pronouncing that right. I'm sorry if I am not pronouncing your names right. Thank you, Mrs. Toyi Aziola. I know I pronounced that right. Thank you, Mrs. Josephine, Mrs. Victoria, Mrs. Irene. Thank you so much, Mrs. Hannah. I really appreciate that. That shows that we are following. So moving on, we have um variations in learning, problem solving, and attention. Next we have is Down syndrome. Trying to be very fast. Oh my god, time is fast spent. Okay, so I'll be very fast because we have just barely 30 minutes to be done. Down syndrome condition. Now, Down syndrome is a genetic disorder. This one is very important that we take note of it. It's a genetic disorder. It's caused by an extra chromosome 21. Okay. Now, in all of us humans, we have chromosomes in our body. We have chromosome 21 in our body. But when a child exhibits an extra of this chromosome 21, the child develops Down syndrome. Okay. Now the characteristics include intellectual disability. Yes, yes, very important that we take note of this. So if your child is very slow, if your child is a Down syndrome patient and your child is very slow in getting things intellectually, please do not blame your child. Okay, take it slow with your child, slow and steady with your child, because that's one characteristic of a Down syndrome child. They have intellectual disability. So don't be in a rush. Okay, take it slow. Take it. Be very patient. I talked about patience. I talked about patience being a virtue. So be very patient with your child. Next, we have distinct facial features. If you see a Down syndrome child, you will know a Down syndrome child. They have a very distinct facial features. Their faces look the same. Their hands look the same. Next is developmental delays. Very important. There are some of them you see a Down syndrome child that is 10 years looking like a child that is 7 years. It is one symptom. Another one we have is potential health issues like heart defect. But do not panic, please. Do not panic. These are symptoms of Down syndrome. So now early intervention is what everybody needs. That's why I'm actually happy. Some parents are texting me and they're saying they have your child is 2 years, 3 years, a year, and I'm very excited. I'm very happy to see that. I'm happy to see parents who have children at such little ages already looking at ways to make their child's life better. It means you are it means you are a super mom. It means you are very intentional about your child's growth and development, and we should give you a pat. You should give yourself a pat at the back for that. You should applaud yourself for that. Your child is 2 years and you're only looking for ways. That is very good. And one thing that this will help you do is that it will help your child improve. Now, I talked about the girls I did therapy for, which was 3+ years. She started therapy at a year plus. That is why at 3 years she could do things. She could read. She could read. I was so impressed with her. She could do things in few weeks. I'm teaching her. The next week she's already carrying on because of early intervention. So it's very important that your child is 2 years, 3 years. Start now. This is the right time for you to start. Don't wait and say, let me just see how it goes. Maybe by 5, 6 years, he would have improved. No, it doesn't work like that, please. Don't be saying by 7, 8 years. Let's see, maybe when he becomes a teenager. Doesn't work like that. Start now. The time to start is now. Okay? Next we have is, oh my god, this is already, I don't have time anymore. Misconception about unique kids for a working mom or a stay-at-home mom. I'm going to be very fast here. I'm going to be very, very, oh wow. Okay. Okay. Misconception. The first one is misconception of incompetence. Okay. There are so many beliefs that special needs children cannot achieve significant milestones. They cannot lead fulfilling lives. That is not true. If you're a parent and you even have such beliefs, please, you have to trash that belief. Take it from your heart, hold it, put it aside dustbin, and trash it far, far, far is a very bad misconception. Okay, there are so many special needs children who have been able to lead fulfilling lives, who have been able to do things. I've seen kids even winning Grammy, even winning Guinness Book of Records, and you see these children having special needs. I've seen an autistic child who won the best painter in which country? I think Colorado. In England, yes, in England, and he's autistic. He had autism. I've watched a movie where the doctor, a doctor that was working on children, I think he's a pediatrician, he is autistic. So don't ever feel like they cannot lead fulfilling lives. Don't ever feel like they cannot achieve significant milestones. No, these children go to school, they go to high institution, they have friends, they do things like normal people. So remove that first. First thing you have to do is remove that thing from your mind. Next is another misconception is people blame parents a lot. Blame on parenting. People assume that the child's condition is due to poor parenting, poor negligence. It is bad. No, 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 no. It's not even possible. Any special needs condition that your child has is not your fault. It's not due to poor parenting. It's not due to negligence. No. Next one is lack of education. People have notion this that the children that are unique, they cannot go to school, they cannot learn, they cannot benefit from formal education. It's not true. Hey, it's not true at all. Parents now support network. Her child is in secondary school already. Okay, the child is going to school, taking gradual steps, doing what a child is supposed to do. Excuse me. Okay, sorry, I always stay hydrated. I'm always drinking water. So take off that notion that children with unique challenges, they cannot benefit from education. They go to school, they do things like normal children. Okay. Next is social isolation. The perception that children and mothers, they should be isolated, they should be kept one side due to stigma. You cannot contact special needs, so it's not contagious. People feel like if your child spends too much time with a child who has a unique challenge, the child will automatically have. It doesn't work like that. It's not contagious. Okay, so there should be nothing like isolation. No, no, it's a bad misconception, and we should take it off our hearts. Next is financial burden. People believe that raising a special needs child is always unmanageable. Okay, it gives their finances a strain without considering available support. There are so many supports and resources that are very, very, very affordable, very affordable. So no, take that misconception out of your heart as well. So I'm going to talk about ways to make caregiving more interesting. Now there are so many ways that you can make this caregiving. There are so many ways that you can make therapy. Don't make therapy boring. Oh, don't make working with your child boring. Every day it's always Jack and G went up the hill to fetch a pair of water. And people will sit down and be singing the rhyme every single day. One rhyme every single day, the same posture, the same way. You are sitting down every time, you're not even standing, you're not even expressing yourself, you're not even doing things that are expressive, you're not even using the rhyme more receptive skills in your child. See, as a parent, you have to be creative. There are so many ways you can make this therapy fun. And you can even make, oh God, I feel like saying everything I want to say now. Like, you can even make your child learn things through rhymes. You can even make your child do things through rhymes. There are so many ways you can make caregiving very interesting. So don't always be like that. Don't always be stable. Move. I talked about being flexible. Be open to new approaches. Be open to new ways, new methods on how you can get this thing done. Okay? Set clear and define priorities. Yes, define your priorities. I have how many more minutes? Okay, so can we still hear me? Can we see him? If you can hear me, in fact, if you can hear me, type two in the comment section so I can be sure that you are listening to me. Just type two in the comment section if you can hear me. Two in the comment section. Two, I'm waiting for us. Two, just two. Thank you so much, Mrs. Evelyn, Mrs. Ade. Oh, Mrs. Hannah, you're very committed. You've been committed since the beginning of this meeting. Thank you. Thank you, Mrs. Mary, Mrs. Mercy, Mrs. Kafilat, you too, you have been very committed to this training. I love that. I love seeing committed parents. Thank you, Mrs. Mercy, Mrs. Irene. You too, I've been seeing you. Thank you. Welcome, Mrs. Bada, Mrs. Josephine. Yes, you are also committed here. I've been seeing your name, Mrs. Ajoke. Thank you so much. Thank you. It shows that we are listening and we are paying attention. So we are going to keep going at it. Set clear and define priorities. You have to define your priorities. What do you want to achieve? We even set goals in our support network. At the end of this month, everybody will bring out their goals. You paste it there. What do you want to achieve? From February 1st to February 29th, what are you hoping on achieving in your child? Everybody will write it. And if any day comes and you have achieved a single thing, they go back and they tick it. Everybody sees, oh, wow, congrats, we congratulate ourselves. So you have to set your goals, set your priorities, and let them be right. Oh, don't set unclear priorities. Set very, very right priorities. Next is that you have to plan your daily activities. If you can, use a notebook. I've taught my parents how to write. Use a notebook, use a journal, write down things. Write your daily activities. What do you want to do today? Your to-do list, write it down. Oh, today we're going to do fine motor activities today. First, we are going to bid and unbid. So I'm doing this bid and unbid so I can get his eye-hand coordination. So what I'm going to do is I'm going to get beads and a single rope. He's going to pick bead one after the other and put it in the rope to develop his eye-hand coordination. That is one goal I'm going to set. I'm going to write it down. So plan your daily activities. What do you want to do today? Oh, I'm going to teach him receptive skills. Today, I'm going to teach him how to take off his shoes and take his shoes and keep it where it's supposed to be. That is what I'm supposed to do today, and that is what I do. So I'm writing it down, teaching him receptive skills under it, taking off your shoes and keeping it in the right place. So David, take off your shoes. David takes off his shoes by himself, pick it up and go and drop it where it's supposed to be. It's a receptive skill. So plan your daily activities. Whatever you want to do today, plan it, write it down. That is what shows you are intentional. Next is share and delegate responsibilities. Yes, so I keep on saying it. You are a super mom, and I salute you. You are the best woman on earth. But please don't carry all the responsibilities alone, except you stay alone with your child. Except you're a single mom, because I have parents I have mothers in support network who are actually single moms, so they do everything themselves, which is very different. But if you have other children, you have grown-up children, your husband is there with you, please delegate responsibilities. Don't do everything on your own. The child should also know other kids, other parents, sorry, other people too. I don't know if you understand what I'm saying. Delegate responsibilities. Today, Tolu, you are going to help your brother. You're going to help him to feed. You're going to help him feed. You're going to hold his hands. He's going to feed himself. Today, you're going to do that. Let's say your child cannot feed himself. So you're going to delegate a responsibility to your older child. Today, hold his hand. Scoop the food with him and let him put it inside his mouth. You are helping him, but he's doing it on his own. You are delegating that into him. So don't carry everything. Don't carry all the tasks, all the responsibilities on your own. Please don't. Share. Share to other people too. Next is go on regular breaks too. Yes, you are doing therapy. There are times where you go on recess from morning to night. No, it doesn't work like that. The child will get strained. The child will get tired. The child will even get child will be tired. So go on regular breaks. It can be dancing break. Yes, it can be dancing break. You people will dance together. You put your phone, YouTube. There are so many videos on YouTube where you can actually watch and learn how to go on all those regular breaks with your child. It can be a video on YouTube, a music video. Can you touch your head? If all of these breaks have, you even learn things, you even get to know things from these things. It's very important that we understand that no matter how you think this therapy goes, you can even make out things from the smallest avenue. You can make out things from bathing time. Oh. From that bathing time, you can get receptive skills from your child. From bedtime, there are things you can learn in every single time. So that break can even be a music break, dancing break, and dancing break. The song will be hello, hello. Can you touch your head? You people are dancing, but you are touching your head. The child is already learning how to touch his head. If you cannot do it, you physically prompt him, hold his hands, and he touch his head by himself too. Can you stamp your feet? The child is stamping his feet. You people are going on break, but you are also learning something. I don't know if you understand what I'm saying. There are things that you can do, and you get things from them. That is why I'm saying therapy is fun. Therapy is very fun. It depends on how you make it to be. Next is single tasks to increase efficiency and produce good results. Don't carry, you want to do something like that. I thought about writing your daily activities, right? All daily activities, do it one at a time, please. Don't say you want to count 1 to 10 with your child and you want to sound A to Z with your child and you are doing it at the same time. No. Let your tasks be single, single, single. Let it be one after the other. You're done with counting. You take it off the table. Let your place not be scattered. Let everything not be one side. Take it off the table. You move to the next one, which is sounding letters. You have A to Z, and you're already sounding it too. So let it be single tasks, one after the other. That's the only way you can produce good results. That's the only way you can increase efficiency, maximize efficiency. Next is create a chore chart to make sure everyone contributes. I talked about delegating responsibilities. This one is also a part of it. Create something like a chart where today, Solani, you are going to help your brother to, you're going to potty train your brother today, Tuesday, Monday, Tuesday morning, you are going to potty train your brother. Wednesday evening, your help is going to do something. So create a chat where everybody knows. Or your husband, you are going to do bathing time with him today. This is what you're going to do on a Sunday evening. So this is what you should do. Create a chat to make sure everybody is contributing. Yes, this is training is for you, but everybody should contribute as well. Okay? Okay. Next we have is learn how to minimize distractions. So learn how this is very self-explanatory. Learn how to minimize distraction. Take everything one step at a time. So I'm going to be introducing the 5 days intensive mentorship training for us. So we have a 5 days intensive mentorship training. This one I just did now is just tip of the iceberg. It's just training for 1 hour. So now we have 5 days intensive, and if you know what the word intensive means, it means we're going to be diving right into it, and it's a mentorship training. So you are going to be getting mentored on how you can care for your child as a unique mom or as a unique therapist or as a unique caregiver. Okay, so I'm going to introducing our support network. Some parents have asked me, oh, talk about the support network. This is the time to talk about it. Now, this is a support network is actually the avenue for you to become an excellent caregiver, excellent mom, excellent therapist. So about this unique childcare support network, what will happen, what you are going to get in this support network is that you're going to get and enjoy a lifetime of mentorship and support. We don't take consultation calls for women who are not in the support network. We don't answer. Okay, I'm going to answer our questions now here because of this training. But aside from now, from today, from today's training, we don't take questions. We don't take consultations from moms who are not in the support network. Okay, so you're going to get and enjoy a lifetime of mentorship. You will learn and keep relearning and keep on learning every single day. Anytime you can reach us, anytime. That is one thing you are going to enjoy by being in our support network. Next is you're going to get networking opportunities. You're going to meet a lot of mothers who have similar challenges with you, similar experiences with you, and you are going to interact and communicate with them. Oh, how were you able to do this? How were you able to do this? Have you been able to do this? What has happened now? Have you progressed? Oh, what is going on? That's what we're going to get from our support network. Next one is special events. Yes, we actually based in Lagos. I'm sorry for people that are staying in Port Harcourt. I'm seeing what are saying we stay in Port Harcourt, Delta. I'm even seeing Bayelsa. I'm seeing Warri. So many, well, our office is based in Lagos. So you're going to enjoy invitations to special events, events that talk about special needs mom, how to care for your children, things and what you should learn from them. You're going to There are social gatherings, support group meetings. We have meetings every month. So you're going to get invitations to all these support group meetings, to conferences that will help enlighten you better. Next is exclusive discounts. Yes. So if you're in a support network, you're going to receive discounts on our products. I know a mother has reached out to me saying she wants to get therapy services from Unique Childcare. And I'm saying, Ma, you have to join our support network first. I'm even doing it for you because you're going to receive discounts on our products. You're going to receive discounts on our services. If you want therapy services, you have to join the support network. That's the only way we will not charge you more. Okay, and other courses, future courses that are offered by our services, you're going to get discounted prices on them. Next is workshops and webinars. Okay, workshop and webinars. You're going to participate in exclusive workshops and webinars to enhance your knowledge. We have trainings every single time so that we know what our parents are doing. We know how they are tackling issues ahead. We know how they're working with their children. So we have so many exclusive workshops, so many exclusive webinars, and that helps them. It helps our parents, enhances their knowledge, enhances their skills. So if you join our support network, we're going to actually participate in all of these webinars too. Next is personal growth. You're going to benefit from opportunities. Excuse me, let me drink my water. Can we still hear me? Can we still hear me? If you can hear me, type 3. Type 3 in the comment section if you can hear me. Where are my women that have been committed? Mrs. Hannah, you've been committed. I hope you're still here. Mrs. Kafilat. People that have been saying, people that have been typing says, I hope we are still here. Mrs. Esther, Mrs. Mercy. Are people still here? Type 3 in the comment section if you're still here. Oh, thank you so much, Mrs. Evelyn, committed mother. Thank you. Oh, Mrs. Kafilat is here again. Thank you, ma. Mrs. Bada, thank you so much. Thank you so much, everyone. Mrs. Josephine, I'm sorry I did not mention your name earlier. Mrs. Josephine has been here since. Mrs. Choma, Mrs. Choma, I think are you coming for the first time? Welcome, welcome. Thank you for being here, Mrs. Evelyn. Yes, thank you, Mrs. Olubumi, Mrs. Victoria. That means we are all listening. Mrs. Mercy, yes, yes, yes. You're all listening. I love that. I love that we're all here. So next we have is personal growth. If you join our support network, you're going to benefit from opportunities for personal growth and development. As you gain new skills, gain new confidence, you're going to be confident in this thing. You will even see the joy of being a unique mom. You will be calling yourself unique mother. Like before support network came in place, most parents don't even know what unique. They don't even regard themselves as being unique. But in our support network, everybody call themselves unique moms. They'll say, "Oh, congrats to unique mothers here," or "unique mothers here." Everybody call themselves unique moms. So now you acknowledge that you have this confidence that I'm a unique person. I'm a unique mother. Do you know what it means to have a unique child? And I'm taking care of my child myself. You have this boldness, this aura, this confidence. So that's what you gain also from being in our support network. Next is you learn how to effectively advocate for your child's needs in educational and healthcare settings. Very, very important. You become an advocate for your child's autism. You become an advocate for autism. You even go out and then go, autism is not the end of the world. Oh, it is ignorance that's the end of the world. So you that don't know anything about autism, I don't know what you are doing. So it's one thing that being in our support network helps you to become. So now people that can join our support networks, unique moms can join, unique dads, that stay at home moms, stay at home dads, working class moms, working class dads. Then we have young caregivers, even matured caregivers too can join. Relatives, you're a therapist, you can join. Relatives of unique children. You have a I've seen people say, "Oh, it's not my child though, but my cousin sister, my cousin brother." You too, you can be part of our support network. So, what you need to succeed in unique child caring, you need to be patient. You need to be patient. This is in conclusion. You need to be patient. You need to be ready to learn. Okay. You need to. I've talked about patience being a virtue before. You need to be very patient. It's not a get rich quick scheme kind of business. It's pure business. So be willing to implement everything you need. Next is, what will you be learning from the class? I talked about our 5 days mentorship program, the intensive training. People that will join the intensive training are people that have actually gained and in part are part of our support network. Sorry, I'm sorry. I drink water a lot. I'm on a 2 liter. I don't know if we are doing that thing too. The 2 liter goal, daily 2 liter goal. Yeah, I'm doing that. So I make sure I complete my 2 liters every day. It's very helpful. It's actually very helpful. We should do that. So what will you be learning from our class? First, you'll be learning how to understand the right mindset. Next is self-care for mothers of unique. I talked about these things, but what you'll be learning is more than what I've spoken about. I'm just talking about this in 1 hour, but these are things that you'll be learning for 5 good days, 5 solid days. So you learn how to understand the right mindset, self-care for mothers, autism spectrum disorder, cerebral palsy, Down syndrome, all those challenges I mentioned, SPD, ADHD, and the rest, and so on and so forth. Identification and early intervention for special needs children. You will learn how to identify and also early intervene for special needs children. Techniques to improve communication skills. So you're going to be learning techniques. How can I improve my child's communication skills? Be it verbal, non-verbal, or imagine verbal. How can I improve his or her communication skills? You'll be learning that in our 5 days mentorship training. Understanding behavior triggers. Sometimes your child is normal, he's fine, he's quiet. All of a sudden, he has tantrums, he's screaming, he's shouting. What triggered that behavior? You don't know. So you're going to be understanding that behavior triggers and cues. You're going to understand. You're going to also learn the importance of play in therapy and development too. Play is very important, very important. You're going to be learning why it is important for your child to engage in play in therapy. Next is time management. So we have working mothers. You don't stay at home. You work 9 to 5. You are very busy. How do I implement this? What time do I have to come and start doing therapy? We have time management for you. So how you can do that? We have the answers to those questions. Next, you're going to also learn celebrating small victories and progress. Very important. Expert guidance. You're going to learn from experienced professionals who understand the unique challenges of caring for special needs children. Now, this training is valued at 40,000 naira and would save money on physical therapy. Next, we have is personalized therapy care plan designed to meet your child's specific needs and developmental goals, valued at 35,000 naira, save you over 100,000 on individualized care plan. Support network, gain access to a community of other parents and caregivers of mutual support and advice, valued at 30,000 naira, save you 120k. Comprehensive resources, access a wealth of resources, including training materials, activity in ideas, and therapeutic tools, valued at 45,000. Lifetime access, enjoy lifetime access to course materials, allowing you to revisit and refresh your knowledge as needed. This is valued at 40,000. You don't have to subscribe on intervals. Practical solutions, discover practical tips and techniques that can easily be implemented in daily routines, valued at 40,000 as well. So now, the bonuses you have in this is that you have one-on-one coaching section, you have exclusive webinars, you have downloadable resources. So you can actually go back anytime. Let's say you missed a training or something, but you can go back and look at that thing, or you forgot something, or you can actually go back. Private support group, we have progress tracking tools, certificates. Yes, we actually give out certificates to our mothers. We actually give certificates to our mothers when they have completed the training. We have emergency care guide, we have sleep training guide, interactive activity planner, we have daily routine schedules. So I talked about you having schedules, right? We can help you with that. We have we'll always call you to ask you how are you doing, what are your challenges, what are the progress. We also have productivity tracker. Now, this training now I'm talking about, the worth of this training is over 200,000. But guess what? Let me shock you now. Somebody say shock me. Somebody say shock me. Let me shock you now. The water pollution is over 200,000, but you're not going to be paying that amount. Even if we decide today to give it out at 100,000, which is actually very fair. It's actually the cost of having a personal trainer. I'm telling you this because I have actually worked with companies like this too. So it will still be a very fair price if we say pay 100,000. But guess what? You will not pay 200,000. No. You will not pay 100,000. You will not even pay 40,000, which is actually the cost of child assessment. But only for the first 25 people that will key in today, you can pay 10,000 naira to join our support network, get access to all of these things I have earlier mentioned. All of these things I've earlier mentioned. Yes, all of these things I've earlier mentioned. What you get being in our support network, you can actually get it if you pay 10,000, but only for the first 25. I'm so sorry. I'm using our company's guideline. Only for the first 25 persons. So after the first 25 persons have paid 10,000, the price goes back to the original price, which is 40,000 naira. So the 10,000 naira is just for people that are paying, the first 25 persons that are paying. Once you're done, the price goes back to 40,000 naira. Slide. Okay, yes. Access to mentorship too. So if you are interested in accessing the mentorship program that will guarantee you to increase your unique child caring skills, if you want this mentorship, this support we are talking about, you can pay 10,000 naira into this account here in this on the screen. Don't worry, we'll also make this post in our group. So you don't have to screenshot or anything. We'll make this in our group. Hmm? Okay, we'll post it now. Hmm. Okay. Um. Okay. So yeah, thank you so much. So I think we are going to be taking questions from now. Let me make the post in the group. We are taking questions. So feel free to ask your questions. It's question time, blessing time. So ask your questions. I'll be taking our questions today. But aside from this training, we don't take questions without you being in our support. We don't take consultation or questions if you are not in the support network. Thank you so much, Mrs. Ayo. I'm so glad you got what you needed in this training. I'm so happy to hear that. Okay. Mm. So you're very free to ask questions. You're very free to ask questions. This is time for, does children with cerebral palsy walk? Spastic cerebral walk? Yes, they can with the right knowledge, right information, and what you need to do. Do the things that you're supposed to do, and you will see. There's no how you will not see progress if you're consistent, if you are committed to your vision. You will surely see progress. You will surely see progress. So what you have to do is that put in the right work, the right knowledge, get what you need to get, research, and you will surely see results. Thank you, Mrs. Ibn. I hope you're cleared. We still have questions. We still have time for questions. So feel free to ask your questions. Feel free to ask your questions. Okay, I don't know where it is. Is there any special drugs for Down syndrome? I will advise you to go to the hospital, go and meet a pediatrician, and you can ask this question to the doctor. we don't diagnose drugs for mothers. We don't do that. We don't do that here. We don't diagnose drugs, supplements. No, we want you to go and get the right prescription from the doctors. Okay, then you come to us and tell us. But we don't do that here. Thank you so much, Mrs. Mercy. I hope you're cleared. Please, what kind of drugs? Oh, I just said it now. We don't diagnose drugs here. We don't. I will need you to go to the hospital and meet a pediatrician. That's a doctor for children, and you tell the doctor your problems, and then the doctor will tell you what to take. Next is, please, my child is Down syndrome, but don't have the look at all. You tell does not have the look. Wow, are you serious? Do you make the proper diagnosis to be sure your child has Down syndrome? Because that is a very key feature in a Down syndrome child. They have the facial look, their fingers look the same. So you should make the right diagnosis. And she's 7 years old, but she's not responding. Maybe she has cerebral palsy and not Down syndrome. But if you're sure it's Down syndrome and she's 7 years now, but not at all and not working, please, what do I do about it? Make the right diagnosis and be sure your child has Down syndrome. Okay, be very sure this is the kind of challenge or special needs that your child has. Then we can work from there. 7 years now, but is not responding. Does she use wheelchair? Is she on a wheelchair? And have you ever worked with any physiotherapist before, Mrs. Chukuma Chioma? Okay, for us, we have few minutes to take questions. What are your products? Since I just mentioned our products, let me go back again to our products. I talked about, now this is my product. This is my product. I talked about I introduced the support network to you and what you will be learning in the support network. Now, we have had mothers who don't give their children drugs, but they have recorded progresses. So let me tell you something. You cannot, I don't want to say you cannot, but the progress is not in the drugs. I want you to understand the progress is not in the drugs. If doctor prescribe drugs for you, beautiful, quite all right, you can take drugs, but that does not guarantee your progress. You have to put in the work. I'm telling you, it's not something that you do today, tomorrow. You have to put in the work. I talked about our support network. I talked about what you will get in our support network. I also talked about what you'll be learning from our 5 days mentorship training as well. Before you join our support network, you will go through a 5 days intensive training, and you are going to be learning so much. I already spoke about this earlier. Yes, I already spoke about this, and I talked about the product that we're selling, and that is you getting access to our support network, and that is accessing our mentorship program. I wrote here, you can, if you are interested in accessing our mentorship program that will guarantee you increase your unique child caring skills, you can pay 10,000 naira into this account, but only for the first 25 people. So I don't know if I've answered your question, Mrs. Tosin. Mrs. Tosin? Okay. My girl has ASD. I'm trying to read this question. My girl has ASD, non-verbal. How can I help her to be able to be express herself and communicate? Now, there are so many ways on how you can help your child communicate better. But first, you have to start it step by step. This is not what's happening to my, okay. You do it step by step, slowly. You take everything step by step. You can start with sounding letters. That's the first thing you have to do. You have to sound letters for your child. Okay. Your child should learn how to sound A to Z. First of all, she should sound A to Z. Communicate, right? Help her to be able to express herself and communicate. Yes, she should start sounding. You should play music, play videos of kids sounding letters, of kids reading alphabet, of kids singing rhymes. You start from there. I cannot come and start answering everything here. That's why you have our support network. I'll be very fast. You have our support network to ask all of these questions and get more insight. How can you help A as a child to keep conversations telling you his need but not responding to your questions? What will I do? Now, what you can do is keep asking. Don't converse, ask him questions. Do you understand? Let him ask, let's be the one asking questions. Don't converse with him. That's actually conversation, actually, but ask him question. Asking him question brings an avenue for him to answer, and in answering, he's conversing with you. My child is 4 years old, but he does not talk like the other way children do. Does he can he imitate sounds? Does he imitate letters? My doctor says my 5 years old boy has, I'm not saying this clearly, syndrome. He has started talking, walking. So, what have you done in the process, Mrs. Wumi? Have you done anything prior to now? How can you help aid child with conversations? Okay. Yes, Mrs. Tosin, yes, the training is just 10,000, but it's only for 25 persons. Sorry, the training, the 10,000 is only for 25 persons. After the first 25 persons, any other person that pays will be paying 40,000. I'm very sorry. I'm sorry about that. I'm following our company's guideline. All the training is for 10,000. You will get trained and you also join our support network. You get discounted price to our product, and it's only for 10,000 naira, but only for the first 25%. After 25%, the rest will pay 40,000. From 2 years now, yet no improvement, despite that I'm attending therapies and seeing a doctor. What have you been doing, Mrs. Calista? Have you done anything? You cannot just depend on the therapist. That's what I'm saying. This training is not only for some people are in this training, but they also have therapists. So, are you doing anything about it? Are you working towards your child's improvement? Have you done anything prior to now? She's not in a wheelchair. That means you carry her along. I'm very sorry. You are a very brave mother. You're a very super mom for doing all of these things. Okay, she's not in a wheelchair. My baby is 1 year old, but it's not saying. Okay, Mrs. Bada, the account number is already posted, right? In the group. My assistant has already posted the account number in our group. So just check our training group. You'll see the account number. Please do well to pay in because it's only for the first 25%. When it passes 25, the rest people are going to pay 40,000 naira. So I'm going to answer your question. I will dilute. I'll send you 5 minutes voice note if you ask me such questions like this in our support network. It does not have a look to mine is cerebral. No, cerebral palsy kids does not have any particular look. The only people that have particular looks are children with Down syndrome. They have distinct facial features. If a child has cerebral palsy, child should look like a normal child. Down syndrome children are also normal children, but they are very unique in their facial attributes. So, Mrs. Calista, your child is supposed to look like how he looks like now. Do you understand? Okay, does he need a therapist? Yes, Mrs. Messi, he might need a therapist, but you can actually do the work. Okay? The mothers in my support network, they don't have therapists. Not even one person has a therapist, not even one. They are doing the work themselves, and they have come to say they have recorded progresses. They have come to say this is what has happened, this is what has happened. So if you have money, if you have more money to pay for a therapy, beautiful. The cost of therapy is actually very expensive, but me, I'm telling you, you can do the work yourself. My son is 8 years old, always touching his parent. Oh my God, without control. Okay, see what you have to do, Mrs. Victoria. Be very strict but firm and loving with him. Okay, he shouldn't touch his private part in public, even in private. He should not do that. It's not nice at all. So caution him. He's 8 years old. He's hearing you. He listens to what you are saying. So caution him. Stop it. Don't touch it. Be very strict with him, but loving as well. Okay, strict but loving with him. Anytime he tries it, caution him. Don't do that. Why would you do that? Don't touch it. It's not for touching. Do you understand, Mrs. Victoria? My son is visually impaired and he cries a lot. Oh, I'm very sorry about that, Mrs. Hannah. Oh, is this Mrs. Hannah? Is this our committed mom? I don't know how to.
It's 10,000 naira for a child.
Okay, so if you send any money to this account, please do well to post a screenshot of your payment in the group. Thank you so much. We're getting payments, but no screenshots. screenshot. So just go and screenshot and post it in the group. Thank you so much. We have come to the end of this training. This training was supposed to be for just an hour, but by God's infinite mercies, we had 1 hour 25 minutes. Thank you so much for taking that time to attend the training. Please do well to ask if you have more questions. You can ask in their training group and we'll do well to answer. Thank you and do have a beautiful night. Okay, Mrs. Victoria, please continue that. She has behavioral attitude, always hitting herself. Stop it. Let her be cautioning her all the time. If she's always doing this, caution her, please. Thank you, everyone. Do have a beautiful night.